Well, good day. I'm Ron Bialik, President and CEO of the Public Health Foundation. And thank you to all of you for joining us for today's webinar, Expand Your SWOT Analysis to Include Inclusion and Equity. Make it a SWOTie. Next slide, please, Jack. I'm going to turn it to Nolan for just a moment with a few housekeeping details for us.
Thank you, Ron. I appreciate it. And welcome everybody for joining us in our webinar. It's great to have you here. Just a couple housekeeping items. When you have joined the webinar today, we did mute you, but we're happy to let you unmute yourself when we get to questions and comments at the end. We are recording this webinar and are planning on posting a web page on the PHF website with this recording, so you can come back and review this information when you would like, or if a coworker that wasn't able to join, they can also check it out. And then please use the chat box for any questions as we move along. We'll be happy to catalog those and get back to those when we can at the end of our presentation. And if you have any technical issues, please feel free to chat me, Nolan Gill, or email me at ngill@phf.org. Simple as that. Thank you so much. Ron, back to you.
Great, thank you. Well, for those of you who may be unfamiliar with the Public Health Foundation, I'm going to spend just a moment talking about our organization. Our ultimate vision is to achieve equitable and optimal health and well-being for all. And we work towards this vision by advancing the public health workforce to achieve organizational excellence. We do this by developing tools and resources and providing on-site and remote technical assistance and training in areas of quality improvement, performance management, and workforce development. Our strategic plan that was adopted earlier in the year by our board of directors includes a specific goal to help public health agencies address diversity, equity, inclusion, and justice, both internally and externally with their communities. The SWOTIE tool in today's webinar directly relate to this important goal of ours. Next slide, please. During today's webinar, we will learn about the SWOTIE methods and tools and hear about its practical application in the Detroit Health Department. Following the presentation, we will have an opportunity for questions and discussions. So I'd like to introduce our speakers today. We have with us Jack Moran and Tiffany Stewart. Jack is PHF's Senior Quality Advisor. He brings to PHF more than 30 years of quality improvement expertise in developing quality improvement tools and training programs, implementing and evaluating quality improvement programs, and writing books and articles on quality improvement methods. Jack is the developer of the SWOTIE tool. Our second presenter, Tiffany Stewart, is the Director of Quality Management for the Detroit Health Department. Before joining the Health Department, Tiffany was a Senior Performance Improvement Advisor at Johns Hopkins Medicine, where she worked to operationalize Lean Six Sigma and project management principles into daily work. Tiffany will be discussing her piloting of the SWOTIE tool in Detroit. So at this point, let me turn it over to Jack.
Thank you, Ron. The idea of this Action SWOT and SWOTIE Matrix came about when back in 2013, we were doing a lot of strategic planning, helping health departments. And one of the things that we found was everybody did a SWOT, and then didn't use it. So I went back and some experience I had before I came to PHF. I was running a hospital. And when I got there the first week to start taking over, it was the annual strategic planning process. 2 days. So the first day they put up the SWOT they had done, and this hospital was starting to fail. And the parent company had given it a couple of more years and they were going to pull the plug. So while they were doing the strategic planning, I was looking at the SWOT and writing the opportunities were the two things we needed to do to raise revenue and increase capacity. And at the end of the 2 days of this, I went back and looked back at the other strategic plans. And 2 years back, the same thing was sitting there. Nobody acted on it. And then they went, so after we got back, within 2 months, I had implemented them, started raising revenue, started increasing capacity. And the amazing thing was when I got the strategic plan back with all the operational things 7 months later, only the lab had thought about how to increase revenue. So we had a new process the next year. So when we started thinking here about SWOT, people were talking about inclusion, equity, diversity. We're hearing a lot of talk about it. So started building this tool, and I was lucky Tiffany came along and was able to try it out. And then we built another one building on, once you get all these actions, how do you prioritize them? So you can find these on the PHF website at phf.org. So the thing is with strategic planning, you hear a lot of buzzwords, and we always do the strengths, weaknesses, opportunities, and threats. And again, a lot of buzzwords. What we want to do is take action and show people how to do it quickly. So the SWOT a lot of times is just forgotten. It's a check the box exercise. We always do it. Every company I was ever involved in, every year we did a SWOT. Most of the times it was never used. Not until I got to the hospital did I see the value of it, because a lot of times in there's action you can take very quickly. And we all know this classic SWOT, threats are a thing we really need to look at and be ready to blunt them if they come at us. But opportunities are there, good ones. And those are things we really want to take some action on. And again, you get down to operational planning. You've all heard all these words. Again, if you're not taking action, they're just buzzwords. So why SWOT? Well, the thing I liked about it, it can be applied to any organization, any situation. It tells 4 stories at once: strengths, weaknesses, opportunities, threats, comprehensive discussions about pertinent issues. You see it all at once. It's simple. Not a whole lot of technical skills or training to do it. And the simplicity of it makes it easy for others to understand it. So you can share information very quickly with staff members. And you can update it on a regular basis. You can play offense and defense at the same time. Maximize your strength, take advantage of opportunities. But again, then you can manage your threats and your weaknesses depending on the scenario. So SWOT, how do you build a better organization? We've all been through this. What are our strengths? How can we use them? What are our weaknesses? How can we overcome them? What are our opportunities? And this is really a key area to look at. How can we exploit those opportunities, make ourselves better? Also, it helps us strategically position the organization. And then what are the threats? Well, how can we defend against the threats? And those are key things we want to look at. So we find is, a lot of people say SWOT's all problems, no solutions. And it's true unless you put the action part to it. SWOT is vague. Well, a lot of times you do broad terms, but unless you build it down into action and go into some depth, it will be vague. And you can't prioritize. So that's why we developed some of the tools to help us take the items out of the SWOT and prioritize in the various quadrants. So this was the first one we did in 2013 and talked about an action SWOT. So you see the threats, you see the weaknesses, strengths, but now what can I do? What are the tasks to make those happen? And that's a key part of making SWOT really into an action. And this is an example here of an issue. Strengths, weaknesses, opportunities. You got your actions to capitalize, prevent, overcome, isolate. So along came the idea we were seeing a lot of times was hearing words back a while ago, probably a year and a half ago: diversity, equity, inclusion, justice. People were talking about them. So I thought this might be a way to get people not to worry about doing a big strategic plan, but how can you just implement things? Take a look at where you are in your community with the various social determinants of health, and then expand it. So what we want to do is make sure that current strategies are impacting change outcome in our community. And we want to really address the systematic inequalities and oppression that we see. So Swati came along, and we're not doing a daily and systems level work in an inclusive and equitable way. We're only making an impact for some of the people in the community, not all of them. So by putting in inclusion and equity into the SWOTie, it hopefully will help you strategically build in inclusion and equity into daily and systems level work. I was hearing from people, a lot of people wanted to do this. They were looking at a way to do it. And hopefully this gave people some ideas. So again, want to make sure we're doing it for everybody in the community. So we expanded SWOT, give it a try, inclusion and equity. And fortunately, I was able to hook up with Tiffany, and she was able to use it, and she'll talk to you about it. Then you can integrate it into your strategic plan once you have it there, or you can just take action with it. Use it as a standalone, and that's a key thing. You don't have to go any further than this, put the actions with it. And it's good to use with community groups because they have a chance to put things up. The nice thing about the tool is it's visual. So if you got a number of flip charts up on the wall and you're writing on them, everybody can see what's happening. And it helps you to capture the key elements of the discussion. Nothing worse than having a discussion and nothing's captured. You can add in justice and diversity. But I looked at these names when I didn't, they just didn't sound right. So that's why I stayed with Swati. But you can add in anything you want. Now, the one thing I found in doing this is you have to have a key definition that's a consensus with everybody that's going to work on it. You can't have everybody have their own definition. Either these two terms or any social determinant of health you're using, it'll help you to analyze. You got to have a baseline in which people can grow up. If you don't have it, everybody will be focused on their definition, and it may not be the same for everybody. So key thing up front, get a consensus definition on whatever one you use, inclusion, equity, diversity, justice. So everybody understands that's the term to look at. And as you go back, that's the definition. Keep people focused on it while you do the SWOT. So this was one I started to build as I was doing this, was, I used community inclusion. So we had some strengths, we had some weaknesses, we had some opportunities, we had some threats. But then what could I do with that? How could I take some action? I'm not going to spend time on the actions, but these are things you could start doing immediately. And you'll see these are in the paper also that we mentioned at the beginning. You can start to take some action right away. You have the SWOT, now it's turning into some action. Now the SWOTie conclusion, next time you do a SWOT, expand it. Do the actions, get SWOTie, get inclusion, equity. Turn those into quality improvement actions and make it an integral part of the health department's strategic plan, part of your quality improvement process. And make sure this will help you to deliver services to be more inclusive and equitable. As you become comfortable using it, you can expand it. Now, what happened was once we got all the actions and Tiffany was doing this, realized we needed a way to prioritize. So we came up with the prioritization matrix. And again, this way will help you determine where best to allocate available resources, short and long-term basis. Want to put the resources where you're going to get the biggest bang. So this is the SWOTie prioritization matrix. On the lower left, you'll see it talks about reinforcement actions. Well, these are the things that you're already doing, and these support existing programs. So you can help those, you can reinforce the good things. Leverage actions are the things that you find that have high impact that you can use to help with the expansion actions. And the thing with the bottlenecks, I always look at the reinforcements as strengths. Leverage actions, your super strengths. Bottlenecks hit the weaknesses and the opportunities, threats, sorry. And you'll see that, some basic ones you always run into is silo funding, short-term grants. We just get it going, run out of money. There's politics, local politics, community politics, there's internal politics. Politics is everywhere. And you find is in the community, there might be many fragmented approaches already going on by some of the community partners. When I was living in Maine, I was president of the Maine CDC Southern York County coalition. And one of the things I found is we had a lot of community partners came in, we gave grants, everybody wanted to do their own thing. So it was very hard to get people to align so we got consistent approaches. The one thing I found, it took many years of patience to get people to come around. Now, the expansion activities are the opportunities. And this is where you can really strategically position your organization. Now, what happens with the matrix is it's static. Your situation is dynamic. It's not just sitting there like the matrix. And not everything fits neatly into quadrants. So you can use ovals and boxes. The other thing you use is arrows to show growth. And you can see that, this is showing us how the things are moving forward. And it's a good way to do it because it's not, don't make it static, make it dynamic, keep adding to it, review it depending on your situation every month, every 2 months, every quarter, but it's a good thing to do. So let me turn it over to Tiffany and she will tell you how she used this.
Thanks, Jack. And thanks so much for having us here today. It was wonderful to be able to walk down memory lane, per se. Jack and I started working together on the SWOTie in February of 2023. So it's been great to just look at the evolution of our SWOTie, and we received a clarion call to move this work into action from our Chief Public Health Officer. So we'll talk about how this work and how these methods were able to help us achieve some of our short-term goals. Here's the state of Detroit's health. Detroit at a glance, we are 139 square miles of land. Our population at the time of this slide was about 650,000 residents. Our population breakdown is as such. We're about 85% Black and Brown, and we have a lot of strengths. Our strengths are deep and rich. Our cultural history provides great scholarship, cultural and industrial legacies across the nation. But we also found that we faced some structural injustices and redlining. We talked about that during our FIT presentation and how that has left us in a situation where we have to move to provide equitable services for Detroiters and provide an opportunity for all of our citizens to be able to thrive. Next slide, please. So a little bit more about the Detroit Health Department. Jack mentioned integrating the SWOTie into the strategic plan. When I landed here, I was pleasantly surprised at the great job that our senior leadership team had already done in integrating equity and inclusion, our community partnerships. So it was really, I'm not going to say that it was simple, but it was a bridge into moving the work into action and defining, as Jack mentioned before, what does equity mean? What does inclusion mean? And it's spelled out here in our mission and our vision. Our vision is Detroit Health Department envisions healthy communities where every Detroiter has the opportunity to thrive. And our mission is to address the public and population health of Detroiters. And how are we doing that? So on the right side of the matrix, we see cultural transformation. We knew upfront that this was going to be a heavy lift, but it did take some courage and some vision from our Chief Public Health Officer to say, go ahead, put in a quality management system, see if we can align that with our governing entity. The city has adopted a lean thinking approach. So in cultural transformation, the quality management team has been diligent in working out joy in work. We use the NACHO methodology. We want joy in our work. FAB also is a part of our cultural transformation. It is keeping us honest as it helps us to build out continued equity inclusion in our community. And then again, we aligned our quality improvement program or quality management system with what our governing entity was already doing, which encompasses a lean thinking philosophy. As I mentioned, equity was already baked into our strategic plan. So this helped us to move our work into action a little bit more quickly because this was already outlined as a part of the work and the focus of the types of services that we want to be reliable and repeatable for our community. And then last but not least, community partnerships. We'll take a deeper dive into how we needed to be innovative. how we needed to bring different community partners to the table. We had to review who was missing, who was there. So we'll talk a little bit more about that as we get into our SWOTie. Next slide, please. So in December 2022, I was charged with re-engaging our steering committee. And this was a bit of a challenge simply because the pandemic and the work had been disrupted because of the pandemic. I was relatively new, but nevertheless, we had a really great core steering committee group that really said, hey, let's figure out how we can gain momentum around this work. We've already done some great work. How can we pick up where we left off? How do we prioritize the work? And do we have the right implementation partners? Next slide, please. So these discussions were vast, but we also took the SWOTie tool and we looked at it at the community inclusion. We looked at community inclusion also through the lens of our community partners. So the additional conversations around our data refresh, we all reached a consensus about how we would update our population health indicators to account for COVID health impacts. Did we need to diversify our implementation partners to include COVID partners, for example? And then finally, with such limited capacity, how would we prioritize all of the work that we needed to do? Next slide, please. So that leads us into our SWOTIE Action Prioritization Matrix. So we had this conversation, we queued it up through the lens of inclusion and equity. Our steering committee, as you can see here, really guided these efforts. So what we decided, we wanted to leverage these actions. Jack talked about that in short. How would we do that? There was just so much to try to unpack and so much to have to prioritize, but the steering committee reached consensus around coordinating health and social services for our community. They also landed on safe and affordable housing. And then they also wanted to develop a platform to access resources. So again, as we leveraged those actions, we knew that we would have to be innovative and creative and link up with our partners. The United Way, they have been phenomenal in helping us to move the work into action, translate the work that we did from our previous community health assessment and make that work tangible, meaningful, and strategic as we built out the community information exchange. We'll talk a little bit more about those efforts later in the presentation. But based off our relationship, and we had to be innovative again, the United Way came in and said, hey, we have been doing this work in the region. We don't want to do this work without Detroit. The community information exchange is a cornerstone of how we feel that we can address equity and inclusion, not only in Detroit, not only in Wayne County, but across the region. So we joined forces in January, February, about 2022. We developed a partnership with the University of Michigan School of Public Health. We had a capstone group cohort come in for the semester, and they really did a deep dive. Primary research, understanding what a community information exchange is, understanding the work that the United Way has already done in the community. We didn't want to duplicate efforts, but the more we learned about the community information exchange, can this be scaled across our programs and services at the health department? Are we, in the sand, spinning our wheels unnecessarily? We basically linked up with the United Way. My partner, Esperanza Cantu, she leads the CIE project team, and she basically said, have at it. So again, the student group came in, did some primary research, and we noticed that there was a disconnect in the understanding of community information exchange, its value, what it meant to our community, how we could use that as a tangible way to address equity and inclusion in our community, the possibility of building out closed loop referral systems. So the more we peeled back the layers, the more we became interested in how we could partner, be innovative in expanding those actions. So as a part of that work and a part of those expansion efforts and the conversations with our steering committee, we knew that we had to update our population health indicators to address for COVID impact. We did that we're currently doing this through Healthy People 2030. There are some things that have bubbled to the top. Since this particular matrix was completed, we received a tranche of grant funds from the Michigan Department of Health and Human Services to start building out our SDOH planning. And then we also wanted to focus on healthy neighborhoods. So again, we leveraged the actions, we looked at how we could move the work into action. And as a result, we partnered with the United Way in the community information exchange space. And then we just continued to work together to make the knowledge meaningful for those who would be in the community, recipients, how people could tap in and get involved. Again, understanding that equity and inclusion was the focus. So we moved through our reinforcement action. So our steering committee, those are our community partners. They were the voice of the customer at the time. I told you that we were pursuing our FAB accreditation. That also keeps us relatively honest because equity and inclusion are baked into those accreditation efforts. Other reinforcement actions are the Michigan Public Health Institute. That's where we get our subject matter expertise, our technical assistance, and then of course, our governing entity. We want to make sure that our health efforts are aligned with the city and of course the city council. There are a couple bottlenecks that were present at the time of the construction of this particular matrix. So post-COVID-19 primary data to update our population health indicators at the time was few and far between. We thought that that was important to note here because if you don't have the data, you can't update your population health indicators. Since then, things have changed in that front. Asset mapping, post-pandemic, the landscape had changed. There was leadership changeover at the highest levels, shuttered venues, a whole host of changes had happened, not only in our organizations, but in our community. So we didn't have asset mapping completed. So that was a huge bottleneck for us. At this time, all we had was a tranche of money to kind of build out our SDOH planning. So funding, that was potentially a bottleneck for us. We talked in part about our implementation partners. Because there was so much transition at the highest levels, we had to revisit our implementation partners and make sure that if anybody was missing, that we were doing our due diligence and bringing those people to the table. Again, long COVID impacts. I think we're still peeling back the layers on what that looks like. Systematic racism, it's a part of our story, but it's not the end of our story. So using our relationships, building our community partners, using all of the resources from our implementation partners is going to help us navigate some of these post-pandemic public health protections. Next slide, please. So that was February. Now we're in September. We still have the same prioritization matrix. But for us, the SWOTie was an anchor. The discussions that we had, there was so much going on, so many bottleneck areas, but to leverage those actions. So basically we took the coordinating health and social services and the platform to access resources, and we combined those efforts. Based off of the feedback from our steering committee, we thought that there may be some duplication of efforts there. And safe and affordable housing, we talked at length about if the health department had the full autonomy to make an effort in this space. So as a result, we just tabled that discussion around safe and affordable housing, and then we pursued relatively vigorously our partnership with the United Way in the community information exchange space, and they were able to build out what we are calling the Connect for Care. We'll talk about that. when I finish this particular slide, but the community information exchange, we wanted to know. It was a high level concept in February, but now as of September 2023, Connect for Care is something tangible, is something that we can attain. So we wanted to make sure that we wanted all of these efforts to be tangible, we wanted them to be meaningful, and we wanted them to be intentional. So we're continuing to expand our actions from February till today. Before we were just thinking about how we would update our SDOH population health indicators. As of today, we have started building out our community health assessment. This is in part due to our relationship with the United Way, actually seeing how a community information exchange can help us to start addressing some of these issues. The Good Housing, Good Health grant, we were fortunate to be able to receive some additional work. Remember, we talked about safe and affordable housing, but we have expanded that work into the housing space. I think that it was important for all of us to make sure that those who were affected by COVID-19 adversely in this particular space, what could we do? We thought that we could also use the community information exchange to try to close the gaps and some of the inequities that we're seeing in this space. So again, we leverage those actions, we combine some of those actions. It resulted in the community information exchange in our region. It is called Connect for Care. This work could not have been done without the partnership of the United Way, expanding those efforts into our community health assessment and into our Good Housing and Good Health grant into the housing space. So equity being the focus, inclusion being the focus. One of the things that we learned as we've been building out this work is that your reinforcement actions might change a little. The city council still remains the same. Our senior leadership team pretty much sets the tone for how the health department engages with the community. But one of the things that we noticed is that our reinforcement actions are also coming from our funders. So again, we mentioned the Michigan Department of Health and Human Services. This work could not have been done without that partnership. We're also getting ready, I think in 10 minutes, the Michigan Housing Development Association. They are also working with us in tandem to put good housing into good grant. Our equity FAB, for example, we talked about how that is baked into the work that we do every single day. The clarion call was to make sure that equity and inclusion was a part of the work that we do every day. So we get that through FAB. We talked about that through NACHO. We're excited to share more about that and see how this work evolves as we host NACHO 360 in Detroit next year. So those reinforcement actions, they changed slightly. So that was important. You might see that change as you matriculate along your journey. I think another point that is really important in the September version of our SWOTie is that we had our first touch point with our residents in about 3 years. So building out the community health assessment and making sure that that was community facing is key. Now we had the community partners and they gave us a lot of information about our community, but hearing from the residents was, I guess, the honey for us, because we were trying to figure out where do we go from here. So touching the residents at our annual block party, being able to pilot our community health assessment, that was also key. So our bottleneck areas, again, we were reminded by our chief public health officer a couple of weeks ago that COVID has not gone away. COVID has not gone away. So there is a uncharted territory. We had new public health threats that bubbled to the top this summer, our air quality. 20% of Detroit residents are affected by asthma. So as we maneuver into the fall of 2023, knowing that COVID has not been eradicated, knowing that the people in our community over the summer were exposed to air quality issues. And so now as we move into the fall, as I mentioned, and these pandemic era public health programs have ended, we see that can be a potential bottleneck for some of the implementation resources that we are seeking from our community partners. So long story short, the strategic positioning of equity, it was relatively easy. This is our current SWOTIE matrix, and it's important to note that we took these concepts from high-level, obscure things into meaningful, tangible, actionable items that can be scaled across the health department and that can impact and have high impact for our community. So next slide, please. So before you cue this up, this is Connect for Care. This is how we figured we could make it make sense. Once we take these high-level concepts, how is this going to work in the community? How can this work in the community? How can we get buy-in from those who will help us to guide this work throughout our community? This video has been developed by the United Way, and this, I think, as a result of the webinar series that the health department was able to contribute to in partnership with the United Way and in partnership with the University of Michigan School of Public Health, I think this really puts the icing on the cake and helps to undergird the importance of a community information exchange and what that could possibly look like in our city and our region.
Communities are powered by their networks and connections. Sharing information, skills, and perspectives enables people in those communities to take complex problems and find solutions. But for organizations, there are often gaps in our communication that limit our connection to each other. And when we aren't connected, it makes it harder to provide services and care to those who need it most. For example, let's say this is Maya, and Maya shows up to a health center, and while community health worker Alicia conducts a needs screening, Maya explains that her food benefits have recently run out. Alicia takes a few minutes to research local food resources, and after a few minutes of searching, she finds an address to a food pantry that she passes on to Maya. So Maya travels to the pantry, but unfortunately, it's not a food distribution day. So she travels home and researches the food pantry's distribution hours and compares them with her own schedule. On her day off, Maya again makes the trek to the pantry and starts another client intake process. When the pantry coordinator hears that Maya is struggling with rent, he does his best to search for agencies that could be relevant to Maya's situation. Eventually, he provides a phone number to Maya. Later, when Maya calls the number, she's asked to again share her story and personal information. Unfortunately, Maya doesn't qualify for assistance at this agency, but she's given another phone number for a separate agency that might be able to help. There is an enormous opportunity to improve the way people are connected to resources by strengthening how organizations share information. Created, owned, and informed by people and organizations like you, a community information exchange is a model first developed by 211 San Diego that helps organizations better serve people. It's not just one centralized database or a specific software. It's a unified network of partners, connected by an infrastructure that supports them and providing coordinated, dignified, and seamless care. It does so by increasing exposure of social and health services through a shared resource directory. It allows a client's profile to be matched to available services they are eligible for, enabling information sharing and managing consent to safeguard privacy. Building on the foundation of 211 and existing relationships, organizations across southeastern Michigan are joining together to create our own community information exchange, Connect for Care. Now here's how Maya's story plays out with Connect for Care. As Alicia learns that Maya's food benefits have recently run out, Alicia can quickly search and find an eligible food pantry only a few blocks from Maya's house. With Maya's go-ahead, Alicia books a new client appointment on the spot. and Maya receives an email with the date of the appointment, along with required documents and the address and phone number of the location. And later, when Maya arrives, the pantry coordinator already has Maya's information from what was collected by Alicia. And when Maya mentions that she's having trouble with rent, the pantry staff can quickly find resources that Maya qualifies for, can see which agencies are accepting new clients, and easily send over a referral. But what's potentially the most exciting is that this is happening across the entire community, helping us understand in real time what needs exist and where networks and connections are working well. Now community members and organizations can work together to advocate for policies and resources that in turn create impact and over time change the system to be more equitable. If you'd like to learn more or join the CIE efforts, visit unitedwayscm.org/CIE.
And before we move into Q&A, I just wanted to
Communities are powered by their networks and connections.
I just wanted to underscore the fact that the Connect for Care, there was no way that we could pass up this opportunity to explore how we can empower our community, not only in Detroit, but across the region. And again, how can we make access to social services more equitable in our community for those that we serve, with inclusion and equity at the helm of everything that we do. We just felt that leveraging that partnership with all of the juggernaut and all of the work that the United Way had done in this space, this is the power of leveraging your partnerships. This is the power of connecting with your community partners and coming alongside to make access to social services more equitable in the city of Detroit. So I'll pass it back over to you, Jack.
And Jack, you can pass it back over to me.
Okay, and I'll pass it back over to Ron.
Okay, sounds good. So thank you so much, Jack and Tiffany. We have a lot of activity in the chat box. I'm going to first convey some of the comments here. In addition to wonderful work, Tiffany, great work in Detroit, we want to learn more. Reinforcing your message about United Way, several people have chimed in saying they're a wonderful partner. There also was a comment about the possibilities to leverage expertise and connections with other types of funders, like businesses, to attract more voices that aren't commonly included in community development work. So there are a number of questions as well, and Tiffany, I'm going to start off with you on this. And I'm not going to take them exactly in the order because there are some questions that maybe we can build on. Can the SWOTIE Action Matrix be used to work on diversity, equity, and inclusion internally in the health department? And does the action plan change at all when trying to apply it internally in the health department?
I think I'll start there. So when my boss came back in with the SWOTIE, we had the opportunity to look internally and externally. So our equity team, who is doing our obviously internal equity work, it does, as Jack mentioned, it's a standalone. So it can be used internally, it can be used externally. I'm a living testimony for that. Yeah, so it is an anchor. It is how can I say, it helps to focus. It's a true north. So it can be used in a variety of different ways.
Great. And Tiffany, what were some of the important practices that help your team communicate internally and coordinate with the agency and external partners to execute the plan?
Right, so we had to stay in really close communication with the United Way. We didn't want to duplicate efforts. We were fortunate to have a capstone team come in. They were finishing out their MPH degrees, and it was a wonderful time to really understand, why don't people know about CIE? How can we close the internal knowledge gap? So primary research, that was our focus, and it was following the lead of our community partner. We moved the work into action because that was a clarion call from the top here. We had the support from our leadership, and we had the wonderful longstanding partner with the United Way, and that really was the impetus for helping us to move this work into action.
And were there any types of training or information preparation necessary or beneficial for the steering committee that you were working with on this?
There wasn't any training per se. I think that's what's wonderful about this tool. SWOT is an old school tool that we have seen for, I'm not going to say generations, but it's been around for a while. The wonderful thing about our steering committee is that they were committed to finding a solution. So using the SWOTie, using the SWOT methodology, using these tools, and we coupled this with a smart sheet. And I think the other piece that's so important is that reaching consensus from our steering committee, that was key. We had to either adapt, we had to adopt, or we had to discard. So using our steering committee, and also to note, I can't believe I missed this. We had some of our steering committee members involved in building out that 3-part webinar series, which allowed us to back into Connect for Care. So again, the steering committee, no training, but the aptitude and the desire to continue equitable work in the community.
And Tiffany, can you discuss some of the PII or data sharing considerations that were built into the program? Is it an informed consent to share with these agencies, something else?
Sure, I would have to defer a lot of those questions to the United Way, but at a high level, that was one of the knowledge gaps. People were interested in CIE, but they said, how do we protect our information? So as a part of this 3-part webinar series, number one, we had to spread the message of what CIE was, what it meant, how people can get involved. We looked at some other partners in the region who are working on this, the Michigan Department of Health and Human Services. They have a CIE task force. And so I think between all of those different counterparts, we were able to move the SWOTie into meaningful action, but it had to be a consensus. I have to drive that part home. It had to be consensus and the desire to move the work into action relatively quickly.
There's a question about engagement of tribes and urban Indian populations in Michigan. Any engagement from this effort or other efforts of the Detroit Health Department?
Yes, there has been an attempt to reach out to the Native American community. We just had a discussion about that last week. As we looked at our implementation partners, we have been feverishly looking for a contact. We definitely want the Native American community at the table. We have yet to find them specifically, but we are definitely considering and want them to be at the table as we build out this work.
And I added in the chat a few trainings that are available on the Train Learning Network addressing health equity. But a question to you, Tiffany, is do you have advice on how to build the capacity of staff on a team related to equity and inclusion topics?
You know, the same response as we did in FIT, I think it comes from the top. As you navigate a post-pandemic space, your leadership really has to, number one, have the courage to say, we need to put in a quality management system so that we can address our infrastructure, so that we can have more equity and we can build out more equitable, that's more public facing. So I think having the support from the leadership, being able to reach consensus and have those relationships. I walked into a wonderful health department that had some really strong relationships. So it was walking the Gemba. It was going to meet these people face to face. It was reaching consensus. I can't reiterate how important that was. And then listen to the clarion call. The vision was made plain. The mission was made plain. So it was really moving the work into action. And instead of integration for us, because that's a huge piece, if you have to integrate equity, inclusion into your strategic plan, that's going to be a bottleneck. But for us, fortunately, our leadership had already integrated that into our strategic plan. So that's how we were able to move into action here at September 2023.
There's a question from somebody who worked in the insurance sector, health insurance sector for a number of years. And the question is, does this partnership include health insurers, or might it, because of the opportunities with clients and potential clients to share information, learn from the community, et cetera?
I think that's a wonderful question. We talked about that last week as well. For us, the MAP 2.0 process is pretty key in making sure that we're looking back. We're looking back to our previous community health assessment, but it's important that through our stakeholder analysis that we're making sure that everybody that we need is at the table. And we did have a discussion about a payer, how important it is to have a payer at the table to also guide these discussions and to also guide this work. So not yet, but hopefully soon.
Got to get myself off mute. I tried to quickly post a link. I got to put the raw, I'll copy and put that in a moment for MAP 2.0, because I have that up on my screen. But so Tiffany and Jack, this is an interesting one. The presentation is superb. What steps can be taken by health organizations to ensure that the SWOTIE policy or practices of the SWOTIE are adopted across the United States? And I would say, Tiffany, just your presenting information and demonstrating how it can be used is one step, but any other thoughts?
Well, I think it should be an issue for the next elections coming up. We should push it out. I think the more they do diversity, equity, inclusion activities, the more they'll use it. But one little step started in Detroit, and I think we'll hopefully push it out through the webinars and things like that.
And just to echo Jack on that point, I think the internal knowledge gap, everybody knows that there's a SWOT analysis, but it's moving the work into action. We, again, received a clarion call. We had to move the work into action. We had to be meaningful about that. We had to anchor that work as public health threats presented themselves. We also had to be malleable and flexible, because that meant resources would have to be dedicated to those mitigating those public health threats. So in short, I agree with Jack wholeheartedly. It is getting the message out there through webinars. It is being intentional, making sure that the message is being fanned out. We talked about cultural transformation and what that looks like, and how we would take a bite of the elephant one piece of a time. Again, bringing in a quality management system, that was key. Making sure we have the right implementation partners, so on and so forth. So those are some of the suggestions that I have.
Great. And this topic comes up quite frequently in our Public Health Foundation Board of Directors, where we have a number of health officials on our board, one from Detroit. Often it's that a lot of folks in the field don't know what to do when it comes to equity and inclusion. And what we're trying to do is to make a tool available and for people to hear stories. And you can't break things with the tool. It's something to try. And it can work within organizations, however you might use it. And, please, if you use it or you have questions about using it, contact us. And we're always happy to talk about it as well. Tiffany and Jack, before I wrap up here with a couple of other resources and pieces of information, any last words from either of you?
Sure, I'd like to thank our Chief Public Health Officer for the opportunity to pilot the SWOTie. I'd like to thank Jack and you, Ron, for keeping us honest as we matriculated through this process. We considered this an anchor. We have a lot of work ahead of us, a lot of conflicting priorities, but I'm a testament to the anchor, how it dovetails with our FAB work. It is important for us to be able to have an anchor again, as we have so many different priorities. Things rise up all the time. So again, thank you to our Chief Public Health Officer. We are lucky to have forged and leveraged a relationship with the Public Health Foundation, and it was a pleasure to be with you today.
Super. Jack, any parting words from you?
I just want to thank Tiffany for making this concept a reality. And she did a great job with it. And I hope she continues on. I'm sure she will.
Great. And next slide, Jack. So just a couple of other resources that may be of interest to people. We at the Public Health Foundation do a lot of work to support public health infrastructure. We have our performance improvement services, a whole variety of trainings and technical assistance opportunities. Something that a number of agencies have contacted us about is a workforce capacity and gap analysis to better understand their workforce needs. And then, of course, there's the core competencies for public health professionals. We have a variety of tools that people can use that are available on our website that people can use to implement the competencies. And last slide, Jack. Also, I'd like to invite all of you to our 2024 Public Health Learning Forum and Train Learning Network annual meeting. During this meeting, we have a whole variety of workforce sessions on everything from topics of health equity, the racial justice competencies, core competencies for public health professionals, recruitment and retention, academic health department partnerships, and more. Our meeting is coming up mid-October, and we still have some seats remaining for those of you who might be interested. Jack, Tiffany, thank you so much for sharing. It was incredible hearing your story, Tiffany. Jack, thank you for developing the tool. We can now say it passed the laugh test. And Nolan, thank you for your assistance on the technical end as well as promoting the webinar. And to everybody, have a great rest of your day. Thank you so much.